Hi, I'm Jennifer Allen reporting for RSNA News. I'm talking with Dr. Frank Minja, Associate Professor of Radiology and Imaging Sciences at the Emory University School of Medicine in Atlanta. We're talking about the RSNA Global Learning Centers, which partner with radiology departments based in low or middle income countries to expand radiology education. Dr. Minja is the program director at the second GLC at Muhimbili University of Health and Allied Sciences in Tanzania. Thank you, Dr. Minja, for joining me today.
Thank you for having me.
So to start off, what are the plans at Muhimbili University and how have they changed due to the pandemic?
So thank you so much, Jennifer, for the opportunity to share about the Muhimbili Global Learning Center. So we were very excited about this opportunity when we applied. And really our plan has been to, we have a very robust radiology residency training program. And now we're kind of moving into the second stage where we're focusing on subspecialty training of radiologists, which in the USA would be more like fellowship training. And so we had already started interventional radiology training program. And with the help of the GLC, the Global Learning Center, we've been able to launch a neuroradiology fellowship program. And this year, we're hoping to launch a women's imaging fellowship, followed by a pediatric imaging fellowship. So really, it's to kind of move our training beyond their 3 years of radiology residency by adding 2 years of subspecialty training. But again, with the COVID pandemic, it's been quite challenging, and mostly in not being able to send our faculty to travel to Tanzania. And so to kind of combat that, we've been using a combination of Zoom meetings, similar to like what we're doing right now in the interview, but also the RSNA is really giving us a trove of online material that we've been able to tap into. And many of our trainees and staff have actually really taken advantage of the really rich repository of information available from the RSNA.
What results are you hoping to see with the department at Muhimbili University?
So really the results, the immediate results is establishing the training programs. And we are really a believer in moving a little bit away from what has been traditionally ad hoc outreach admissions that go for 3 to 4 week operations. But we really feel really to build sustainability, we need to establish actual training programs. And really the results are going to start to be seen in like 3 to 4 years when our trainees graduate from these subspecialty training programs and they begin to become part of the Muhimbili faculty. And we're very pleased that actually some of the faculty at Muhimbili joining in part of these fellowship training programs because they feel that they really want a full, well-rounded training. So many of them may have additional exposure to neuroradiology, additional exposure to pediatric radiology, but they've never really had an in-depth 2-year immersion in the specialty. So that's really the hope, is that we will actually get the training programs established, but these training programs will begin to actually produce a faculty moving forward.
So what inspires you to encourage radiology education for radiologists throughout the world?
I mean, one, I'm a beneficiary of some like really amazing teachers myself. I graduated from the Yale University School of Medicine radiology residency training program and neuroradiology fellowship. And really what drew me to that program was the amazing teaching I received there. And this is one way to pay it forward. And then the other piece of it is that there is a real dire shortage of radiologists in general, but also subspecialists in particular in lower to middle income countries. For example, I'll tell you that Tanzania has something like just over 1 radiologist for 1 million people. You can imagine we have much less at the subspecialty level. And really, there is no substitute for actually training more radiologists. And the only way to produce radiologists is to actually create training programs. And so we are really committed to improving the training of radiologists. But in addition to that, we really want to have it at the curriculum base. And so that's why I really feel that we are going to use these 3 years to build up training programs that will hopefully become self-sustaining moving forward.
What would you say to radiology departments that are kind of on the fence about applying to be a GLC in the future?
Oh, if you're located in a lower to middle income country, I I'm not sure why you would be on the fence. We are working in Tanzania, but the challenges we have in Tanzania pretty much apply to most of the sub-Saharan countries. I would say of the 55 countries on the African continent, I can only imagine maybe Egypt or South Africa have a decent number of trained radiologists. The rest of the 53 countries barely have training programs. And if they do have training programs, they certainly don't have subspecialty training programs. So I think the Global Learning Center really offers an amazing opportunity to tap into the RSNA online resources. But most importantly is I am excited once the pandemic is under better control, is to really put the wealth of RSNA faculty in contact with our trainees. And so that's really what we're really looking forward to, plugging in our trainees into the RSNA network. So I would really encourage any radiology department to apply. Maybe you won't get it this year, maybe you'll get it the following year. But in any case, I think it's an amazing opportunity, and I highly encourage everybody to look into it seriously.
Thank you, Dr. Minja, for your time today.
Thank you so much, Jennifer.
To learn more about the RSNA Global Learning Centers, visit rsna.org/GLC. And for more radiology news, visit rsna.org/news.